Hi everyone, my name is Anupam Singh. Welcome to my LifePage. Today we'll be talking about medical coding. But before that, I'll give you my introduction. I did my 10th from Delhi Public School Aligarh and my 12th from the same school. Then I went for graduation to Hindustan College of Science and Technology, and I had my campus placement for this company nThrive Global Solutions. I'm working since then in nThrive Global Solutions only as a medical coder. It's been 4 years now. I will tell you. Medical coding is an integral part of billing. It's a system of codes for disease and services provided by healthcare providers. It's a billing between providers, healthcare providers, hospitals, and medical insurance companies. Medical coding is a system of codes which are assigned for services and diseases, services which are provided by healthcare providers, directly doctors or hospitals. To get into medical coding, you need to be CPC certified. This is a certification which a coder has to have to do medical coding. CPC is basically about CPTs and ICDs and HCPCs. These are some courses which we study for these certificates, and we have codes here. The codes have some dollar amounts which have been paid by the insurance company to the healthcare providers, the doctors and the hospitals. The first one is CPT, that is current procedural terminology. In CPT, we study about all the services which are provided by our doctors. We convert those services into the codes, and those codes have some dollar amount which are paid to the healthcare provider or a doctor. The first one is detail orientation. One has to be very detail oriented to be a medical coder. You need to focus on every single detail of the medical record of the patient, because we need to assign codes basis on those details only. The first one is monetary benefit. The client give you budgets for your parties, for your outings, and apart from that is incentives. When you achieve your target and you do more than what is expected from you, that is when you overachieve your target, client gives you incentives which is in dollars. So I find it very motivating to work for a client which are US based. The first challenge is learning and memorizing the codes. There are over 70,000 codes in medical coding, and you need to learn and memorize each code, because you cannot go through the books every time you see a documentation. Also, there is always an increase in the number of codes every year. So if you're not good at learning the codes, it becomes a little difficult for you. Coder. We generally work in morning shifts. Our shift starts at 9 and ends at 6:30 p.m. Our day starts with reading emails which we receive from our clients, and whatever feedbacks we receive from our clients, we go through them first while starting our new work. We have daily targets. After going through all the emails and reverting to the emails, we start our work and we implement whatever the feedbacks are given by the client over the emails. We implement those feedbacks in our daily work. The medical coder, if we finish our daily target before time, I can overdo my work and I can have incentive for that. In operations, when we do medical coding, our work is being audited by auditors. The quality checks are there, quality assurance is there. So they give us the feedback. So we have meetings with quality auditors as well. We have team huddles with our team leaders, managers. We have to implement those minutes of meeting in our daily work. And if there is any call from the client's end, we need to stay back till 9:30 or 10:30, whenever the call is being scheduled. We have meetings with clients. For that also, we need to stay back. If I encounter any critical case in my work, I need to go through all the books, all the softwares, all the guidelines which are provided by our clients. Even if my problem is not solved, I go to the auditors, and if they are even not able to resolve my issue, I'll have to call the client directly. I'll get my problem resolved. Only after they give a go ahead to me, I'll start working on the critical case. I find it very smooth and very energetic. I don't get tired at all. Every time I go to work, I encounter new cases which are very interesting. The only thing which I have to be very careful about is I have to keep the information, the patient healthcare information, very secure and protected to myself only. This is how my day goes as a medical coder. I hope that I have given you a balanced view about medical coding. I hope the information which has been given by me is very helpful to you, and I hope that I was able to make you understand what medical coding is all about. Thank you.